Hello everyone. In this video, let us discuss about why stakeholder engagement is important in systematic reviews. What do we mean by stakeholders? Stakeholders mean people or groups who are impacted by an issue. In systematic review context, they are the group of people involved in the issue that shape the review question. Stakeholder, as a very broad term, may include anyone affected by an issue and or anyone who can provide input on the topic. So it is review specific or the review context specific. The stakeholders are review context specific. Who are the stakeholders? It can vary based on the review context. Service users such as public, patients, students, all people, family carers, etc. could be stakeholders. Service providers such as doctors, nurses, teachers could be stakeholders. People ensuring service delivery such as managers, supervisors, administrators. Decision makers also could be stakeholders, policy makers, government, local organization, staff, etc. Organization and bodies representing stakeholders such as advocacy groups, industry, media, union, also another category of stakeholders. Evidence users such as academics, policymakers, researchers, public, they are also stakeholders. So it varies, depends on the review context. So we need to carefully select the stakeholders which are relevant to a particular review question or the topic. Is it beneficial for systematic review process? Why we need to engage stakeholders? Stakeholder engagement aims participatory research and might direct the research question, define the scope and context of the review, as well as contribute to the literature search, evidence synthesis and interpretation, and might facilitate dissemination and use. So you can see that stakeholder involvement is beneficial in all stages of systematic review. It enhances the relevance of findings for policy and practice and contributes to the sustainability of health system. It broadens understanding and different perspectives could be added to the review process. Usually, the review team consists of academics, researchers, methodological experts, statisticians, information scientists, etc. So, to have a broader understanding and different perspective from the public, from patient groups, from children, from a variety of stakeholders will be beneficial for the review process. Involving stakeholders reduce bias by providing critical and transparent approach. As I mentioned before, it makes the review more relevant for target audience. So when we do like an academic group or a research group conduct a systematic review, sometimes the way we write things, the way we communicate and the findings may not be relevant, relevant or easy for the target audience to understand. So by involving stakeholders, it makes the review more relevant for target audience. And especially it improves the accessibility by translating jargon and other terms which we use regularly in the academic literature. So involving stakeholders will help us to communicate reviews in a better way, and it is more accessible to the target audience. So stakeholders can help us in a wider dissemination process. Usually we conduct the review and we publish in a journal, academic journal. But by involving stakeholders, we will get new ideas, creative ideas of communicating the findings through different types of mass media and other organizations, etc. So when to involve stakeholders? They can be involved in all stages of a systematic review. So involvement range from prioritizing review questions, to commenting on draft findings and communication. So a greater level of involvement often occurred in reviews focused on health or social inequalities. So it's very important for health and social reviews. The stakeholder involvement is a critical component in these type of reviews. So users could be involved in the review team, so we can involve them as a part of review team. Their inputs are useful in protocol development, especially in formulating review question, conceptual framework. The conceptualization of the review question is very important, so that stakeholder involvement or input will be helpful in these beginning stages, and also that to develop inclusion criteria. They also help to identify relevant studies. Sometimes the experts and the people involved in the service provision or service delivery, and also in the various aspects of the topic or the systematic review question, so they will be able to identify the relevant studies. So they may know some studies done by some organizations, some projects, etc., which is very much linked to the topic. They could be involved in data extraction. Mainly it is like, helping whether the relevant data is extracted, or what type of data will be more useful for the target audience, etc. Assessing study quality, especially the relevance. We will be able to assess the methodological criteria, quality, all that, but the relevance to the target audience. So that is very important. Relevance of the systematic review, that could be assessed by the stakeholders. And their input will be helpful in synthesizing the findings. And also an important area of communicating and disseminating the review findings. They could be of great help. So does systematic reviews routinely involve stakeholders? So the answer is yes and no. So this is a systematic review done in 2019, published in 2019 in BMJ Open. They looked at characteristics of stakeholder involvement in systematic and rapid reviews. So they looked at whether the reviews involve stakeholders, what type of involvement, and their characteristics. So the findings were stakeholder involvement was mentioned in 13% of Cochrane systematic reviews and 20% of non-Cochrane systematic reviews. A slightly more, like 43% of rapid reviews involve stakeholders. So you can see the stakeholder involvement is not routinely practiced in systematic reviews, but I can say confidently that it is increasing. The newer, if you see the new systematic reviews coming out, they are very likely to involve stakeholders. And 93% of rapid reviews from Center for Review and Dissemination from University of York, they involve stakeholders. So we can see the CRD rapid reviews turned out to have by far the highest proportion of reported stakeholder involvement. But if you see 13% and 20% of non-Cochrane systematic reviews did not have any stakeholder, did not have a reported stakeholder involvement, because in this systematic review they looked at the published systematic review, and the stakeholder involvement, the process of stakeholder involvement has to be reported in a systematic review. So they found that most of the reviews it is not reported. They must have had some form of a stakeholder engagement, but since it is not reported, it is not picked up or not considered as having stakeholder involvement. So how to involve stakeholders? The involvement of stakeholder vary. It depends upon the nature of the review question, the availability of stakeholders, the resources, the time, and also the decision of the review team to involve stakeholders or not. So the stakeholder involvement vary. There can be like some form of involvement at some particular stage, or there could be active involvement throughout. So how to involve stakeholders? We can listen to them, we can understand their perspectives and their ideas, especially when we are conceptualizing the review question. And we can also consult stakeholders, asking specific input from stakeholders, and the reviewers can decide what to ask and how to use the information. We can use them as collaborators. Planning and decision making responsibilities are shared between review team and the stakeholders, and they also could be involved in co-producing. So there is varying degrees of involvement of stakeholders we can see in systematic reviews, but in generally stakeholder involvement is really worth, and it adds value to the systematic review, and it definitely has a lot of benefits. But it has its own we have difficulties to involve stakeholders because of the logistics and the resource involvement, time, etc. But it is ideal to involve stakeholders in conducting systematic review. So thank you. Please like, share and subscribe if you find this video useful. See you again.